Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Hi, good evening, everyone. I'm Dr. Srishna, and we are delighted to welcome you all to today's webinar organized by Drools in collaboration with Indian Association for Veterinary Dermatology, India. Thank you for the time to join us for this important academic session. To formally begin, I would like to invite Dr. Sumati to deliver the welcome address and set the tone for today's webinar.
So, good evening, one and all. On this wonderful Sunday evening, it's my pleasure to offer the welcome address. We have had a series of webinar with the Drools and IAVD last year, and it was a very successful program, enlightening program, and it was a great knowledge sharing. We had a lot of speakers in the previous session in 2025. In the same pattern, this year also we had planned with the Drools as a platform for this education program. IAVD takes an immense pleasure in starting the program, kick-starting the program today with Dr. Madhavi Awale. I welcome all the participants for this program. Enrich your knowledge with this program and be interactive for this question and answer session too. I welcome the Drools team who are there hosting this program and all the office bearers of IAVD for this first of this year's program, starting with Dr. Madhavi Awale. I will also invite Dr. Madhavi, who is going to kindle all your brains. And today we are going to have a lot of insights on the allergic part of it. Over to the Drools host.
Thank you, Dr. Sumati. So before we proceed, we request all the participants to please fill out the forms shared in the comments box to receive your certificates. So now it's my pleasure to introduce our esteemed speaker for today, Dr. Madhavi Awale. So Dr. Madhavi is the owner of Pet Wellness Clinic, Pimple, Sodagar, Pune, and has actively participating for the last 10 years. She completed her graduation from Bombay Veterinary College, Mumbai, and post-graduation from STAU, Gujarat. She has pursued advanced certification in small animal dermatology from the European School for Advanced Veterinary Studies across Austria, Indonesia, and Thailand, and has also completed the Certificate of Knowledge in Dermatology from the International E-Learning Veterinary School. Dr. Awale is an administrative committee member and life member of the Association for Veterinary Dermatology, India. So now we hand over the session to Dr. Madhavi for her expert talk on feline allergic skin diseases, what to know, focusing on recognizing patterns, confirming diagnosis, and managing allergic dermatitis effectively in cats. Over to Dr. Madhavi.
Hello, everyone. So I'll first share. Is it visible for everyone? The
Yes,
presentation?
doctor.
Okay. All right. So, hello everyone. It's first of all, I would like to thank AVD and Drools both for giving me this wonderful opportunity. And it's a Sunday, and I can see quite a lot number, which I was not expecting because it's a long weekend. So, thank you guys for listening, and I hope I don't bore you guys. So, the topic for today is feline allergic skin disease and what to know. Now, when the first word allergy comes in your mind, what is the first thing that comes? It's always dogs. Okay, you see a dog, you think about atopic dermatitis, you think about food allergy. Okay, if I'm going too fast, please you can just drop in a comment saying that it's I'm going too fast. I can go a little slow. So as I said, when you talk about allergy, the first thing that comes in your mind is only about dogs and atopic dermatitis. In fact, the focus on atopic dermatitis is so much over a period of time that there have been multiple vets, multiple speakers, multiple sessions who are only focused on atopic dermatitis. There are certain vets who have actually dedicated their life for atopic dermatitis. But when it comes to feline allergy, it's a little not paid attention, probably, and everything. But over a period of time, the last few years, you are actually seeing a much difference in feline dermatology. We are able to now pay attention to the disease recognition. We are having a better understanding of the pathogenesis of these diseases, and we are trying to figure out more treatment, newer treatment, and how to manage. Now, remember, cats are not small dogs. So, whatever you have been treating in a dog does not apply to a cat. And in fact, feline allergic skin disease is so common that still we do not know. We do not know because we are not able to understand this disease. We do not understand because the classic textbook language of atopy in dogs is that there is redness in the ears, there is redness in the paws, there is erythema and hyperpigmentation in the axilla, there is otitis, there is pododermatitis, right? But when it comes to dogs, this applies. In cats, none of these conditions happen. None of these cutaneous lesions are seen, and because of that, feline allergic skin disease, although it is very common, it has been till now undiagnosed. I have multiple cases that they were not diagnosed as FAS or FASs, and that is why the diagnosis was delayed or the treatment was delayed. So we need to understand that feline allergic skin disease along with asthma is quite common in small animal practice. And so today I'm just going to tell how to figure out or how to identify the lesions in a cat unlike dogs, so that we will be able to better understand allergies and handle these cases. So let me first explain you about the basic. When you're talking about these two conditions, the term I'm going to not bore you guys with the terminologies, but if you don't understand these terms, it's going to be much difficult to understand later. So let me just give you two terms. One is feline atopic syndrome, and second is feline atopic skin syndrome. Now, what is feline atopic syndrome? It's actually a generalized term. It's a generalized term for hypersensitivity disorders, which are classic with allergic dermatitis, respiratory disease, and gastrointestinal disease. Now, these can be associated with both food allergy as well as environmental allergies. And FASs describes where there is inflammation, there is pruritus. It's an allergic skin disease which is associated with only environmental allergies. So in short, FASs is a part of feline atopic syndrome. So when I say feline atopic syndrome, means I may be talking about food allergy and I may be talking about feline atopic skin syndrome or environmental allergies. But when I'm talking about FASs, means I already know that this cat does not have any secondary infection. I'm already understanding that this cat does not have any dermatophytes. I am saying that this cat does not have food allergy. I have done a food trial, and finally I have come to a conclusion that this is feline atopic skin syndrome. The same way as you do for an atopic dog. You rule out everything and finally you confirm that this dog is atopic. So allergic dermatitis in cats is actually because of three basic things. It's a very easy thing. Unlike dogs, it's not very complicated. You have flea allergy, you have food allergy, and you have FASS. That means environmental allergies. So, as I mentioned just before, when it comes to dogs, you have the classic textbook language. You have, when flea allergy, you see that the lesions are on the rump area. You see on the paws. And if it's atopy, it is on the paws. If it's malassezia, it's on the neck. It's under the chin. You see under the ear pinna. Whereas in case of in case of atopy, you see the axilla, the groin regions. You have pododermatitis, you have otitis. But in cats, you do not have the lesion. So how do you differentiate? It's a very nice way. Their cats have just 4 cutaneous reaction pattern in the sense that the skin shows, or there are arrangement of lesions on a cat's skin which the cat actually reacts to various stimuli. It can be flea, it can be food, or it can be environment. And then there is pruritus. So if you find these 4 reaction patterns, if you see the cat, the cat has come to the clinic, you see there is itching, and you see these classic 4 patterns, you know that, okay, I see these 4 patterns, that means this cat may be allergic. Now, don't come to the conclusion because you attended this lecture and you're like, okay, now this is, I see this pattern, I see 1 pattern, I see 2 patterns. Yes, this cat has an allergy, and start the treatment. No, you have to rule out the basic, which I'm going to talk about later on, which is not going to be too boring. But then finally, you understand that there are 4 patterns. First is miliary dermatitis. Second is head and neck pruritus. Third is self-inflicted or self-induced alopecia or hypotrichosis. And finally is eosinophilic granuloma complex. I'm sure you all have heard about eosinophilic granuloma complex. But when it comes to EGC, now you understand it's actually a reaction pattern. It's not a disease. It's not a condition that you just need to treat. You see a EGC, you need to take care of EGC, but you need to understand it's a reaction pattern. That means there is something that is causing this pattern. There is something that causing this kind. It can be some kind of an allergy. Now, so the reaction pattern, as I mentioned, is not a definitive diagnosis. If you see this pattern, don't get excited and start the treatment for allergies. You have to rule out the parasitic etiologies. You have to rule out if it's mites. You have to rule out fungal. You have to rule out bacterial, malassezia, everything before confirming that this is actually a kind of an allergy. Now let's talk about miliary dermatitis. You can take the photograph of this classic lesions. You can actually put it in your clinic, somewhere in the drawer. It's a very simple thing. Miliary dermatitis means, in the name, it is written as millets. Okay, the millets means the small sesame seeds, the mustard seeds. They're small size, millets. These miliary dermatitis, you find these small papules on the forehead, or near the eyes, sometimes on the on the neck, below the neck, over the neck, and in certain cases it's generalized. Fortunately, I did not have any cat having a generalized miliary dermatitis. Most of the times I have seen on the face. So this is a kind of a cutaneous lesions. Now these are small papules, and later on they convert into small crust. And there is definitely itching. Because of that, there is excoriation, that's erosions. Very rarely you find these ulcers, but most of the times it's a alopecia. There's quite a degree loss of hair, and may or may be with pruritus. Now the problem with miliary dermatitis is when the cat comes to you, most of the times it's not seen, or unless and until you pay attention and you look carefully. If your cat has long hair, it's a Persian cat with very long hair, you might be having this miliary dermatitis, but it gets undiagnosed because you are not able to see unless and until you check the hair and you pull back the hair and see. So if a cat owner comes to you, a pet parent comes to you and says, you know what, my cat is non-stop scratching. You see on the surface and you do not see any lesions, don't just ignore. There is a possibility there are small papules just below the hair, and that has to be checked carefully. So this is the photographs. I generally have a nice collection of photos, but unfortunately when it comes to cat, I have less photos because half the time the cat is very aggressive. The cat is not very, unpredictable. They don't allow me the photographs. So I have tried to still put as many photos as possible from my clinic itself. So you can see here in this cat, you can see the nice, beautiful papules you can see on the forehead. It's on the ear also. And here also you can see that there is quite amount of alopecia. There is a little bit of crusting, and you can see here also on the nose. So understand that these are a kind of a, papules, but all of these cat are domestic short haired, and that's why it's easy to check. This can be missed in case of Persian cats. Now, generally, miliary dermatitis is seen in flea allergy dermatitis. So the moment you see miliary dermatitis, you know, okay, this cat may be having fleas. But please, when it comes to dogs, it's much easy to see a flea and or flea dirt. With case of cats, it gets undiagnosed or it's not that careful. So you have to understand that if you do not see fleas does not mean that your cat does not have fleas. Always ask this question: is your cat outdoor or indoor? If your cat is indoor, then ask the next question, that do you have other pets or do you have a dog? There is a possibility that the dog does not have, the dog has fleas, but he is not allergic, but the cat is having a flea allergy. I had a patient recently where the cat showed this kind of head and neck pruritus. So I suspected it could be a flea also, and had miliary dermatitis also. So I asked if they have fleas. And they said, no, my cat is completely indoor. It's a Persian cat. So I was like, okay, fair enough. So I asked if you have a dog. He's like, yeah, I have a dog. So is your dog on any flea control? He said, no. But my dog does not have fleas because he is not scratching. Now your dog is not scratching. So I just asked them, can you get your dog tomorrow also, please? Let me just give a checkup of your dog. And believe me, when the dog came, I saw fleas on his body. The dog was not, the owner was shocked. He's like, okay, but my dog is not scratching. This dog was a 45 kg lab. Here, half the time he was so obese that he must have not even cared about scratching, or might be he just he does not have allergies, he does not have flea allergy. So you have to understand that now I have started doing this anti-flea treatment, the flea control treatment for both of them simultaneously. So you have to understand this point also. Next comes self-inflicted alopecia or hypertrichosis. Now this is my favorite because it is something that is interesting and it gets missed most of the time, and most of the time people actually think that this is self-induced alopecia, self-inflicted alopecia is associated with psychogenic. Yes, psychogenic is one of the factor, but there are multiple studies who have mentioned that self-induced alopecia is not only because of psychogenic. Most of the times it is more associated with allergies. Now, what is self-induced alopecia? I'm sure you must have seen this. It is where the cat continuously licks on the abdomen, on the ventral portion of the body, continuously licks. Sometimes it's licking, sometimes it's biting, and they lick and they literally pull off the hair, where scratching can also be involved. Now you have to understand it's a little difficult to know this because the pet parent in most of the times comes to you saying that my cat has suddenly lost hair. And when you ask the client, is your cat a little scratching, or is it licking of the hair or anything? The owner will be like, no, my cat is not having any of these, my cat is not licking. Now the cat owner is not lying actually. There's a possibility that the owner is not at home when the cat is doing all this drama, or else there is a possibility that the cat goes in a secluded area behind the cupboard or under the bed or something, and that is why the cat is actually licking and the owner doesn't know. So how do you identify this? I asked two simple questions to the client. I asked the first question, if by any chance you see that, have you checked his poop recently? If not, go and check the poop and see if there is hair tufts in the poop. Or else, the second question I ask is your cat having recent bouts of vomiting? If your cat is vomiting more frequently, there's a high chance that the cat is actually gulping the hair. So before I go for trichogram, where I get a final diagnosis, I get that final confirmation that this is self-inflicted alopecia, I also check with this question. So if the client is saying, yes, recently my cat is vomiting a lot, and then there is hair loss here, you know that this cat is over grooming. Now, because of over grooming, there is actually tuft of hair, which is the cat is swallowing. So, over grooming should not always put on stressful condition. You have to take your consideration of allergies too. So these are the two cats. This is the first cat is actually a a food allergy patient. And you can see actually the alopecia, but there is no erosion. There's no erythema and there is no redness. And this, you can see. So this cat actually came to my clinic because the cat was non-stop itching. So the cat was on constant collar for almost 2 months. And if you remove the collar, the moment you remove the collar, the cat actually starts licking and over grooming. Now, funny part is generally cats are scared of clinics. So when they come to the clinic, they do not show that classic, all the symptoms which the owner is complaining. But here, the cat was there for 40 minutes. I was talking with the client for 40 minutes and this cat kept licking non-stop. You can see the seriousness of this. So this cat unfortunately was actually psychogenic. So I have put both the cats. One is psychogenic induced alopecia and the second one I have mentioned is because of food allergy. I hope I'm not going too fast. If anyone thinks it's too fast, you can please put in the comment. I can actually check with it.
Yeah,
Okay.
doctor, we are getting some requests to please keep it a little slow.
Okay. Thank you so much because I cannot see the comments. I can go a little slow now. Okay.
Yeah, please.
All right. Thank you so much. Sorry for the inconvenience. All right. So self-induced alopecia. I hope now I'm going slow. My husband also came and told me that you're going too fast. So let me go a little slow. Okay. So now, I hope you have understood till now. Don't worry. It's going to be repetition even if you have missed. The first is miliary dermatitis. I have explained this is self-induced alopecia where I'm trying to tell you that this is because of over licking and over grooming. Now, how do I diagnose it? Now, the client doesn't know. The client said, okay, I don't think so. And you are thinking, no, I think the cat is over grooming and that is why there is sudden loss of hair. So what do? You actually pull the hair. Okay. You pull a few shaft of hair around the lesion. So wherever the lesion is, wherever the alopecia is, around that alopecia, very close to that alopecia patch, you just pull few hair, but you have to be gentle. You have to be gentle because you want to see the fractured hair fragment. The hair, because of over licking, because of over grooming, the hair actually shaft breaks. So you are going to check the hair shaft which is broken. But if you pull it very harsh with the artery forceps, the hair can actually break. So you are going to check for a fractured hair shaft. And if you can see in this photograph, actually, you can see that this is fractured hair, the hair it's like a bone, your bone, how a bone breaks. You can see that it's edgy on the edges. So the hair, if it breaks down, you'll find these kind of fragments. And this is alopecic areas may or may not be erythematous or excoriated. One more thing about this. Now, you see, next time you see a cat with complete alopecia, okay? So don't come to a conclusion that, okay, we attended this lecture and it's self-induced alopecia and, come on, this is allergies. No, it's not that, okay? You need to I understand there are two more things that also come into picture. Three more, actually, I'm sorry. If the alopecia is only along the inguinal canal, means where the bladder is, okay? If it is very close to the bladder, the cat is non-stop licking only on the bladder. The first photograph which I showed, you will see the alopecia is almost from the sternum to the entire abdomen. But if the alopecia is only on the inguinal area, you should consider cystitis also. It's a part of medicine, but because the cat comes to you in the form of dermatology, that's why I'm telling you. All these are interconnected. Dermatology is not only about the skin. Dermatology actually tells you if there is something systemic also. So if you find that this is only around the bladder side, if there is licking non-stop, there's a possibility that the cat is licking because it's irritation. Might be the cat has UTI, might be the cat has urolithiasis, might be the cat has idiopathic cystitis, anything. So in that case, you know better. You're first going to go for urine analysis, you're going to go for AST, you're going to go for a USG and an X-ray also. Second, If the alopecia is only on a particular area on the limb, probably, or something, always ask. It's not on bilateral, okay? It's on a single leg and only on that area. Ask the next history. Did this cat have any previous trauma? You need to go for an X-ray. Now, I had this cat, not here. I when I was in Thailand, I was working with in a clinic. That time, this cat came to me. This cat, not to me, to that the clinic. The cat came because of non-stop licking of that leg. So this cat had actually 1 year back had a history of fracture, the compound fracture, and it was actually the surgery was performed. But because it was a little the skin, the tissue around that lesion, around the fracture, it had become gangrenous, and because it had become gangrenous, they had to go skin grafting. They did a skin graft, but that skin graft had become a little tight. So what happened is now the cat actually came because they thought that it is dermatophytes. The general medicine sent it for a consult to a dermatologist, saying that this is a case of this because this is probably a case of dermatophytes. When the cat came there, we saw that actually the cat was licking only on the particular area. Had it been dermatophytes, it should have been spread on other parts also, but only on that. So the dermatologist there actually asked, the client that you think this had the cat had any previous trauma or any surgery done, and they said yes. So what had happened is, because the skin was stretching over a period of time, it was actually causing irritation to that cat, and because of that, this cat was actually licking. So we actually send this cat back to the orthopedic, saying that is by any chance we can redo the surgery, you can remove that skin graft, or else then we were going to keep this cat on gabapentin. So this is how it's going to be. You have to identify the cause, because most of the time the systemic disease or the some trauma maybe, but the cat comes to you thinking that this is a kind of a skin infection. Then comes hyperthyroidism. If you find a cat and it's an old cat and it's age related, hyperthyroidism should be considered. Of course, there are other symptoms also of hyperthyroidism. The cat is very hyper, the cat is excessive agitated, the cat keeps moving. I do not have a single case of hyperthyroidism. Unfortunately or fortunately, I'm not sure. But if your cat is hyperthyroid, the cat is so agitated over a period of time that she keeps licking, he keeps licking to remove the tuft of hair because they do not know what to do. So you need to treat, and fortunately, we have we have these medicines for that. I hope now I'm slow. I hope I'm going well. Okay. Then comes head and neck pruritus. Now, this is something that you all have seen. All the patients, all the vets have seen this case where there is itching on the head and the neck area. There is non-stop itching, especially on the face, head, and neck. At the same time, it is also referred as head, neck, and pinna because the pinna may be also involved if there is mild otitis. So here the cat keeps scratching, and this cat scratching is so bad that sometimes you have to go for quick medicines also orally. At the same time, you have to also go for, what do you say, wear a collar or a donut collar, something like that. So you need some physical way to stop that itching also. And blepharitis may be observed, but with or without associated corneal ulceration. Obviously, because the cat scratches so badly that sometimes it's the nail that actually causes injury to the cornea. So these are my two patients. The first you can see that it's severe excoriation around the eyes. You can see there is erythema on the face. A little, the photograph is not that clear, but you can see here also, near the ear pinna also, there is mild alopecia. And this is a classic place of the neck, okay? So this one, second one, which is on the neck, is actually a cat with FASS. And this first cat is actually with a food allergy. So this kind of itching is most difficult because the cat is so irritated, the owner is so irritated. So most of the times the client comes to you with running, saying that my cat is in a miserable state. And when the cat is miserable, the client is miserable, and the client is miserable, they make your life miserable. So it is a little difficult to manage, and in such cases, we need to first take care of food allergy. Cutaneous adverse reaction to food or food related allergy show this classic head and neck pruritus. Of course, in FASs also, but in flea allergy, it is not that common. In flea allergies, mostly it is miliary dermatitis, as I mentioned. And finally is eosinophilic granuloma complex. When you come to eosinophilic granuloma complex, you need to understand the cytology is very, very important. You do not confirm EGC without doing a cytology. Cytology and biopsy are the first rule to confirm that this is EGC. So what do you see? You see three classic lesions. First is indolent ulcer, second is eosinophilic plaque, and third is eosinophilic granuloma. So this reaction is actually associated with fleas, environmental and food allergy. It is quite common, as I mentioned, that cytology and biopsy is something that is required. All right, so this is the cytology. Just to give you a clear, this is recently we had done about 3 days back. You can actually see that you see neutrophils. You can see, but is it visible? The three cells are there. These three eosinophils are there. You can see that the nucleus is prominent, but the cytoplasm is actually in red color. It takes a pink and red stain, which is little bit granular. Unfortunately, in the photograph, it's not that the granular cytoplasm is not that clear. But if you see under the microscope, you see beautiful granules in the cytoplasm. So if you see eosinophils and not one or two, it should be many eosinophils, then you confirm that this is EGC. So let's talk about the indolent ulcer. The first is indolent ulcer. I had around 2 months back, a cat came to me because the vet thought that this is squamous cell carcinoma. It is an SCC. So this is a very interesting case. It was actually a small indolent ulcer which worsened up, and when it worsened up, it actually moved towards the nasal planum and it affected the nasal planum and the nasal alar also. So what happened is it was actually a EGC. It was an indolent ulcer, but the owner, the vet thought that this was a SCC. So they referred it to an oncologist, and the oncologist sent this patient to me. And that's when I confirmed that this is actually EGC. So it was as easy as possible. Just a cytology could have helped. So what happens is here, you find a small focal ulcer on the lip margin, very small. So ask the client, because most of the times the clients come very late, okay? You find a small indolent focal ulcer on the lip margin. It starts with the lip margin, and later on there is deformity because it starts moving towards the lip and towards the nose. And then there is fibrosis. It becomes thick, it becomes very, very thick. So this generally kind of lesion is not pruritic. Although eosinophils are involved, but in case of eosinophils, you do not, in the indolent ulcer, itching is not there unless and until there is secondary bacterial infection. So I can show you the photograph. This is a beautiful case of indolent ulcer. As I said, I had 1 or 2 more, but the cat which I said we could not take because extremely aggressive cat. By the time we could take photograph, the cat had been stressed. So we could not take the good photograph of this. This cat thankfully was very calm, so we could do. You can see it actually has caused a little bit of fibrosis over the edge, and if we would have not treated, it would have kept moving towards the nose also. Then comes eosinophilic plaque. I'm sure you all must have seen. Here you find actually circular to oval, sometimes eroded, sometimes ulcerated on the abdomen, on the ventral portion, ventral abdomen, and the medial thighs. Here itching is definitely there. The cat is itching, and because of that itching, further there is lesions. I will show you the photograph of that also, but there is secondary bacterial infection also. So this is a beautiful eosinophilic plaque, beautiful for us, but not for the client. And in this second picture, this is actually a little eroded because the cat was licking. So in this cat, actually the cat was not itching that much. So thankfully, okay. Here, the cat was actually itching, so there is erosion also. And this is a severe case. This is also on the medial, in the thigh, it's on the abdomen, ventral abdomen, but on the thigh region also, but you can actually see that there is erosion also at the same time. Then comes eosinophilic granuloma. In eosinophilic granuloma, this is actually where there are multiple areas. You can see in the photograph, it's under the chin also, a little bit on the paws also can be involved, but mostly it is on the thigh regions, on the caudal part of thigh, which actually keeps moving. So it is more of a linear. The indolent ulcer is a small portion, but here it keeps moving towards the linear way, and it goes towards the stifle joint also. Pruritus may be present, may not be present. And here, because the chin is involved, you actually see that the chin has become thick. So many people have actually misdiagnosed this as a feline acne, but it's not feline acne. It's actually fat chin, and that fat chin is actually because of eosinophilic granuloma. So here you can see it's a fat chin. This cat actually came to us saying that this cat actually got hurt somewhere. They don't know about that because it's an indoor outdoor cat. The owner thought that this could be because the cat went for a out and must have hurt somewhere on the roof or something, or the branch. But this is actually a fat chin. When we did a cytology, then we confirmed. If you see closely in this photograph, right above you can see a small, on the lip, upper lip also you can see a small part. See, that is probably, it could be a start of indolent ulcer also. So here we could see two. Okay, we can see eosinophilic fat chin also, and you can see an indolent ulcer also. So finally, diagnosis of reaction pattern. Now, once you have diagnosed the reaction pattern, you put a chart and you see, is there one reaction pattern or two or three or multiple? Okay, mostly it is one or two reaction patterns. Never you have seen four. You now have seen a cat which has come with itching, and you have known that this is a cutaneous reaction. You have identified that, but that is not the confirmation. That does not mean that this cat is allergic. You first need to understand that you have to identify that is there anything secondary thing which is going to be. So observe the lesions, look at the entire, and then undermine the pattern. So first, you have to ask the history. So as I said, you saw the cat, you have identified the cutaneous reaction pattern, ask the history. History taking is a very important part in case of dermatology. In case of orthopedics, observation is very important, very, very important. But in case of dermatology, it's more about history taking, more than observation and diagnosis. So ask if this cat is young, middle-aged, or geriatric. If it's old cat, you might have any hypothyroidism, you can have any systemic disease, any tumor. If it's a young or middle-aged cat, if it's possible, then it's possible that this is atopy, this is food allergy. Check for the duration of the skin disease. Has it occurred first time, or is it chronic, or it's a seasonal? Seasonal is very important. If this owner says that is it in a particular season, it could be flea allergy. If yours is not a tropical climate, in tropical areas like Maharashtra and south of this, flea season is throughout. But I think in north, because when it's cold, you do not have that much of fleas. So possible that it could be fleas. Okay. Then second is, we are talking about if it's seasonal, then it could be because of any particular seasons, any pollens that are involved. Then comes the patient lifestyle. Okay. The patient lifestyle, ask if it's an indoor, outdoor, and ask for travel history. Unfortunately, the travel history is not that important for us because we don't have so many cats moving around. But check with if it's indoor or an outdoor cat. Okay. This is important because flea allergy is a very major problem. And that means if your cat is outdoor and indoor, please check if it's, it could be fleas. Changes in behavior. This is also important part because any change in the behavior, like I'll give you an example. A cat client came with a severe skin infection, The cat was very bad. There was a lot of, infection, alopecia and everything. So when this cat came to me, we asked one history. As I said, we also asked other questions also. So we asked, is your cat having any UTI, or how is the how is the other condition? Now this owner, the husband and wife, the wife was in a little difficult mood, in the sense she was a little blaming the husband. She said, yes, It's possible my cat is having a little bit of, it's possible my cat is having UTI because my husband recently is not changing there are a lot of clumps in the litter box, and my husband is not cleaning the litter box. The husband is looking at us and he said, no, I am cleaning. I am definitely cleaning. Okay. The client is like, she said, no, I see everyday clumps. He said, no, but I am changing the litter box. That's when it hit us. And I was like, okay, so let's see. Let's hope the husband is telling the truth. Obviously, women are born to not believe that husbands are telling the truth. They always think husbands lie. So I was like, let's do one thing. We'll just check the blood glucose. And here, the cat actually had diabetes. So actually, the client, or the husband was telling the truth. The owner was actually cleaning the litter box, but the cat was going multiple times, and because both are working, they didn't realize that. And actually, the cat was suffering from iatrogenic Cushing syndrome. So this cat had iatrogenic Cushing's because the cat was being applied lot of clobetasol before, and then this cat got iatrogenic Cushing's, and after this iatrogenic Cushing, she got diabetes, and because of the stress, she got dermatophytes. So this is how we treated the skin infection. History taking is very important. Always check for the systemic disease. Check for the pruritus. If the cat is not itching, it can't be any kind of dermatophytes. In dermatophytes, the cat has to be itching. I have a cat, I will show you the photograph. I have a cat which was treated for fungal infection. But when I asked the history, is your cat itching? And she said, no, the cat was never itching. That was my first clue. When I did a cytology, I saw acantholytic cells and I confirmed it for pemphigus. So this cat was having pemphigus, but actually was being treated for dermatophytes. Always ask the dietary history. And when I'm asking the history, means the real history. Tell the client, what does your cat eat? If they say they eat this, or Whiskas, or some kind of a food, they say meow, or any of this Drools, anything, don't believe them. Ask, okay, what else? And they say, no, the cat eats only that. No, what else? Are you giving any treats to the cat? Are you giving something else? Are you giving any toppings? Sometimes the client gives just once a week some treat or some chicken or some fish, and the cat owner doesn't realize it. So, and they think that it is just once a week, so it is not the food. Ask them this history again and again. What do you give in the morning? What do you give in the afternoon? What do you give in the evening? Ask if there is any other individual or any other dog or any cat in the same vicinity having the same kind of infection. And finally, response to previous treatment. This is a very major thing. If your cat has been kept on any treatment and did not respond, you should realize it. If this cat has been kept on any antibiotics, sorry, should I go slow? I cannot
No,
go
doctor.
slow. Yeah, I can't go.
Please continue.
Yeah, I can't go too slow, guys, because it's a time limit also, and I have something more also. So if anyone has questions, I will answer that later on. Okay, can't go too slow for this. Sorry for that. So if the cat has not been responding to any other treatment, this is important. If this cat has been kept on any glucocorticoids and this cat is not responding, then understand this, there could be something else. If the cat has been kept on antibiotics and has not responded, does not mean you start the next antibiotic. Does not mean that you have given clindamycin, the cat is not responding, you go on cefpodoxin. Understand, if the cat is not responding to previous treatment, there is something else. So figure out by doing further test. Go for a cytology, go for a AST. Do not just start the random treatment. This is very wrong from our part. Consistent and correct use of flea treatment, which is very important. As I mentioned, flea treatment is important. Even if you don't see fleas, always do the spot on treatment. So finally, this is actually physical examination. If it's most common areas are head, neck, ventral abdomen, and head skin. Oral cavity. Any cat which comes for a dermatology, always check the oral cavity. It's very important. If you see a AGC, if you see erosion on the ventral abdomen, you see on the legs, Open the oral cavity. Believe me, half of your problems are solved. If there is a granuloma, because in EGC, you will find the tongue is affected. You will find the hard palate affected. You will see there is an ulcer on the upper lip also. So always open the oral cavity and check. If it's a EGC, you might see that lesions inside also. If it's a eosinophilic granuloma, there is inside also involved. The oral cavity is involved. Flea combing, then obviously for a flea allergy, and ears. Ears in cats, they do not have this classic otitis how dogs have. Yes, it is seen, but it is mostly associated with FASs and in certain times in food allergy. In flea allergy, otitis is not seen. So if you have otitis, always check for otoscopic examination. Open, check it. If you don't have an otoscope, no problem. Take a earbud, take a nice gunk on it, take it on a slide and see it under the low power microscope. As I said, it's very easy to just keep a small microscope. It's not very big investment. See it regularly. You will see the difference. It's actually much, much, much better because these small things, the mites, the demodex, the sarcoptes, and in case of otoscopy examination, the ear mites, with microscope, it's easy. You cannot send the sample to a lab because I do not believe by the time for sarcoptes, you try to send the sample, the mites have already gone. This is a very funny thing. Many people say that we actually send the sample to the lab and it came negative for mites. How do you know it is negative for mites? Because you take a sarcoptes, if you do it in a clinic, you take a mite and you take a sample skin scraping. By the time you're observing and you want to show the client also, these scabies mites have actually run away. Those suckers run away. So it's important that it's case of mites, you do not trust the laboratory because this is not possible for mites only. So finally, we are coming to allergic dermatitis. As I said, flea allergy, food allergy, and feline atopic skin syndrome. I'm trying to go slow. Thank you so much. Flea allergy dermatitis, we all know, but we need to understand in case of dogs, when it is FAD, you have that classic itching on the back. The rump area is affected. But in cats, it is not the same. The cats, it could be miliary dermatitis, it's on head and neck. Most of the times, rump is not affected in case of cats. That's why I said cats are not just small dogs. So what you see in dogs does not apply to cats. So if it's a fleas, we all know it is also called as FAD, and it is not, the classic lesions are not very peculiar. We all know it is because tenosyphalitis, felis. Food allergy. Food allergy is something that I had given a session previously also. It is very important to understand. Most of the times, we all go wrong when it comes to food allergy. We start with a food trial and you start the food trial and you do it for 2 weeks. Food trial is not of 2 weeks. It is of 8 weeks. Okay. I'm going to talk about that later on also. But we always make a big blunders when it comes to food trials. Most of us go wrong in food allergy trials with a client. And it is quite common. It is very, very common. It is almost 10 to 25% and 11% of the cases of miliary dermatitis. The reason I have put these numbers is not to bore you guys. I just want to show you that it is that common. Okay, it's just that I wanted to emphasize it that this is very common. 11% of the miliary dermatitis is because of food allergy. And allergies in cats is fish, eggs, chicken, and dairy products. Now, I have not put beef and pork because it's something that in India, we do not give that commonly. So I have not put that. This cat is actually a food allergy. So you can see the head and neck. So here, what do you see? As I mentioned, you see it's an erosion. You see head is affected. You can see a little bit of pinna also affected. So your cutaneous reaction pattern will be head and neck pruritus. So I look at this and I say, okay, this is head and neck pruritus. My first cutaneous reaction is there. The photograph is not that beautiful, but actually you can see a little bit of miliary dermatitis. So my second pattern is miliary dermatitis. Okay, so check. I'm going to make sure I take a cytology. I will see how the cytology is. If there is no bacteria, then I don't have to give antibiotics. There is no secondary infection. Then I'm going to confirm that this is not fungal. So I'm going to check with a Woods lamp. Unfortunately, the owner put some haldi, the turmeric on it. So I could not do the Woods lamp. I did a cytology to check arthrospores, and definitely I sent it for fungal culture. But before that, I made sure that this cat was kept on an e-collar. I put a donut shaped collar so that the cat is not itching, because here also some lesions were seen. And I started with certain anti-itching medicines. But I kept this cat on a food trial. I told the client that I'm going to keep your cat on a food trial, so please don't expect results in first 6 weeks. 6 weeks minimum to lagega. It's going to be that much time. You have to keep patience. Meanwhile, the cat doesn't make some lesions. I definitely did the skin scraping. I ruled out mites also. But if it would be mites, it would have been bilateral also. Okay, so this is not bilateral. This is unilateral only. So the food, so dermatology signs are generally associated with food pruritus, miliary dermatitis, alopecia, self-mutilation, and otitis externa. But there are gastrointestinal signs of vomiting and diarrhea. We never ask this question. This is not a cat, but this is just yesterday. We had a German Shepherd which came to us. 4 weeks back, this dog came with a severe itching on the on all over the body. So I looked at it and I suspected this could be food trial. Before confirming it's atopic, I did my minimum test. I did a skin scraping. I checked for cytology. I confirmed it's not fungal infection. Then I started with food trial. Yesterday, this client came to me and he said, "You know what, doctor? Her itching is much reduced." I was very happy. I'm like, okay. And then he said one statement. He said, "And doc, her poop has become very firm now." So I'm like, okay, I missed this question. I said, what? What do you mean by that? He's like, "Since 3 years, I didn't know that the poop had to be so perfectly formed. Now my dog is having perfect poop where I'm actually able to pick it up." So I missed this question. I had not asked this question about the motions. So this owner is a first time pet parent and he didn't know how a normal poop should be. So sometimes this also can be missed by us. So ask the client, how is the poop? The cat may not know that this poop is actually not normal. And if it's possible, take some photographs and show him the consistency. Is it this stuff or is it this liquidy? Is it this liquidy? So the client can actually put the finger on it and say, okay, my dog or my cat has this kind of a motions. So understand, gastrointestinal signs are generally involved. Most of the times the client actually does not know. So diagnosis of food allergy is first history. I said physical examination. First do the gold standard method, that is elimination diet trial. Okay. Elimination diet trial should be of 8 weeks minimum. Now the studies say that it is 8 weeks minimum, where 6 weeks the cat starts showing response. After 6 weeks, almost 80% of the improvement is seen, and by 8 weeks there is 90% improvement. But GI signs, as I mentioned about this German Shepherd, they start showing much earlier. But it's important for you to understand that the studies have said 8 weeks. For me personally, I have seen 9 to 10 weeks in case of cats. For dogs, 8 weeks, amazing. But for cats, it is 9 to 10 weeks. Now, when we are doing about the food trial, please understand it is a food trial. So you have to have two options. First option is a novel protein diet. That means the protein this cat has never eaten or a dog has never eaten. When I'm saying novel protein, when you say a novel, it means the protein has never been consumed by any other way. Does not mean that the client has not given. So what happens most of the times, I have this cat, the cat comes to you or the dog comes to you, and I ask, is there some protein he has not eaten? And the owners, because beef is not that common, pork is not common, the client says, I want to give lamb. Is it okay? And many times our vets say yes. Now, my question to you is, when you say lamb, are you sure this lamb by any way has not been consumed? How do you know the treats which the dog has eaten? And that may be multiple. We love to give treats to our clients, right? To our cats or dogs. My own dogs eat a lot of treats, and I don't even know 4 years back what treats I had given. I don't remember. So, how do you know this dog or your cat has never eaten lamb in any other way in some or the other treat? I myself don't know about my dogs. So, you need to understand when you are giving a novel protein, you have to be absolutely sure this cat or dog has never eaten, even in the form of treat. If the cat has eaten or the dog has eaten that protein before, this cat or dog is going to show a reaction. And you will actually not understand that why, even in spite of giving a novel protein, as per you, the dog or cat is reacting. So this is first thing. So I like to give hydrolyzed diet. I have one client who was ready to give beef, so they kept the cat a dog on beef. So that's okay, that's fine with me, because I'm sure beef is not something that is very commonly kept in treats also in India. So you can give that kind of protein. So what do you do instead? I like to keep on hydrolyzed proteins. It can be a very low molecular weight, which is 1 to 2 kilodaltons. That means analogenic food, or else you can keep on a semi-hydrolyzed diet like hypoallergenic food. Now, when you're keeping the dog or a cat on this food, on hypoallergenic food, means the cat has to be kept on exclusive of that. Please do not give the toppings. I know multiple cases, multiple cats or dogs have come to me who say that, my dog is on a hydrolyzed diet, my dog is on, or my cat is on a hypoallergenic diet. And I asked, what do you give in the morning? We give that. What do you give in the afternoon? We give the same thing. And what about evening? Same food. Then I asked the question again. And at 4 o'clock, if when you're having something, what do you give? We give some makhana, or we just do a little bit of topping. We just add a little curd. Curd topping is so commonly, I don't know, the love, we Indians love buttermilk, we love curd. And that's why we want the cat or dog also to have curd or buttermilk. I don't understand why. We don't have to give the dairy product when you're doing a hydrolyzed protein diet. So here you cannot give a topping. And I know why this happens. The owner keeps bugging you. The owner calls up and said, Doctor, my dog or my cat is not eating. What do I do? You say, no, your cat has to eat that. After 2 days, they call, nahi, abhi bhi nahi khaya, doctor, but then how can I keep my cat or empty stomach? How can I keep my dog empty stomach? You got so annoyed, you have to handle other patients also, and you said, oh, okay, just add some topping. Wrong. You cannot add a topping for that. You cannot give a topping. You need to keep on a strict diet. For dogs, it is much easy, because in case of dogs, you can tell the client that, keep the dog empty stomach. But cats, you cannot keep empty stomach, because the cats go in hepatic shock. They go immediately. There is ketosis. So in that case, if you have this problem, add 2 different brands. Hypoallergenic diet, add 2 different brands. I have seen that cats love to choose. They love that when you give them one food, they are not happy. So you add 2 different foods, 2 different brands. So you tell the client that it's going to be a little expensive, but add 2 different diets. So either you mix it and give it, so the cat is a little excited. Okay, this is different flavor, this is different flavor. Or else you give today this brand and tomorrow this brand. That actually helps in my patients. I have actually done that, and it is much easier to give it. For dogs, I don't do that. But cats, because they're very picky eaters, you can try that. So as I mentioned, in case of food trial, you go for 8 weeks of food trial. Strictly, first 6 weeks, there is no improvement. You have to explain the client that if your cat has on this food, please don't come to a conclusion that, 3 weeks and there's no improvement, stop the food. No. And finally, we are talking about feline atopic skin syndrome. Okay. Thank you for still being there. I am not seeing people leave. So feline atopic skin syndrome means, obviously, it's like atopic, means environmental allergies. It can be dust mites, pollens, molds. I'm sorry, I just remembered I did not put one video. I have one dog for atopic. So all atopic dogs, I tell them to get their dust from their surrounding. Okay, I always tell the clients to get some dust, especially on the bed, their pet's bed as well as their beds. I tell them that 2 days don't do any dusting and just get the dust. I actually got the dust and I checked them under low power microscope, and I have seen the dust mites. I show the clients that there are dust mites. So these dust mites are responsible for atopy. And amazingly it is. It's beautiful. If ever you are interested, you can just ping me. I can show you the video. I'm so sorry I forgot to put it in the presentation. Atopy dogs have dust mites allergy most commonly. So anyways, FASs is very common. It's quite inflammatory. The cat is non-stop itching, and you always have these patterns, at least two. It can be one or it can be two. I have not seen more than two ever. So frequently involved areas are face, head, neck, pinna, even legs and abdomen, self-induced. Less common areas are lateral thorax, flanks, and lumbosacral area. Lumbosacral area in cats is not that common. Occasionally, you can see it is multifocal, and that's where it gets confusing. With dermatophytes also it is, and that's why you have to be careful about that. If you find multifocal areas, it can be dermatophytes, and it can be this also generalized also. Atypical is pododermatitis with or without plasma cell involvement. Remember, pododermatitis in cats is not that common. Dermatophytes can cause under the nail bed, not pododermatitis. And plasma cell pododermatitis, I'm unlucky. I have not had a single case. I have fellow vets who have seen these cases, but I am not there. I have not been that lucky. And otitis is always there in 20%, 20.9% in patients with FASs. These are my patients with FASs. You can actually see that there are lesions on the neck. It's the ear pinna involved, and here there is otitis also. Again, I don't want to bore you guys with this, but it's just wanted to show that the prevalence rate, if it's a FASs, the maximum is self-induced alopecia. That's why I said that it is one of my favorite. Second is head and neck pruritus. Third is biliary dermatitis, and fourth is EGC. And remember, about 37.7% of the cats have two or more of these reaction patterns. Again, FASs and food allergy, especially with FASs, there are other signs also. GI signs are also there, but although it is 3.9. In case of food allergy, GI signs is more. But in case of cats, in FASs, also you do see conjunctivitis and respiratory disease. So always ask if your cat has been sneezing or if the cat is showing certain symptoms of cutaneous lesions. Cats are not that easy. So that's why the history taking takes more time for cats compared to dogs. Reported age is between 6 months to 4.8 years. That's why young age cats, FASs is more common. Not that commonly seen in old age. I have never seen in an old age cat, but it's possible. Never say never. And these are the breeds that is commonly seen. The Abyssinian, Somali, Himalayan breeds, yes, Maine Coon, Siamese, and Devon Rex. But I do see in domestic shorthair a lot of FASs. So first, rule out flea allergy dermatitis, and second is do food allergy. My thing is, if you have confirmed or you do think it is FASs, always keep your cat on flea control. It's very, very important. Keep your cat on flea control, and it has to be a little aggressive. It should be almost every month. Then specific differentials is ectoparasites. Check if it's not mites. Please check for Lynxacarus, and always see for secondary infection, Malassezia or Staphylococcus infection. So these are the cats which look like FASs. Here you can see this is, I thought that this could be fat chin, but this is not fat chin. This is because of allergy, because of flea allergy. This is a case of notodris. You can actually see the bad infection. It's crusty and the ear pinna is involved. There is head and neck pruritus. And this is sarcoptes. Look at this condition. It's a very bad case of sarcoptes. Look at this. So here also you can see the head and neck pruritus. So looking at this, you actually think it could be some kind of a allergy, right? This is Lynxacaris. Okay, I put, oh, I didn't put the photograph of Lynxacaris. So can you see this in the hair? It's like dust. Some dust is sprinkled. So it's like salt and pepper look. So this is actually a Lynxacaris, and if you see such case, you can see under the low power, you see a lot of mites, and the cat here is non-stop itching. So you don't see any lesions, and you think this could be allergy, but if you see closely, there is a sprinkled dust on the body. So finally, we see the cat. How do you do the diagnosis? The cat has come to you. The cat is itching. Okay. So you see the cat is itching, and you see that you look and you check the physical examination. You ask proper history. Now you have to see the dermatological database. So you see the miliary dermatitis, you see self-induced alopecia, you see head neck pruritus, and you see the eosinophilic lesions. When you see all of these, you now need to identify doing the basic test. If you see miliary dermatitis, you can just take a snapshot of this. You see miliary dermatitis, you know you have to do cytology. You have to rule skin scraping, and you have to rule the parasite treatment. The fungal treatment, fungal culture, and you have to do the parasite treatment. If you see self-induced alopecia, you need to do the skin scraping. Your cytology, not important. Why? Because you don't see any excoriations, you don't see any lesions, so cytology doesn't work. So don't waste your time on cytology in self-induced alopecia. But fungal culture, important. Head neck pruritus, everything has to be done. Eosinophilic lesions, cytology, and parasite treatment has to be done. Now, by the time you're doing these tests and you're confirming if there is some secondary involvement or it's fungal involvement, you know that this is some kind of allergy. Okay, so you have to treat the pruritus. You cannot move ahead if you don't treat pruritus, and that has to be with oral glucocorticoids. Prednisolone is well received by cats with higher dose. You don't have to give for a longer duration, for 5 to 7 days. You can give glucocorticoids because in cats, the glucocorticoid receptors are less in number. In dogs, there are more. So in dogs, you have to be careful. In fact, in cats, because the glucocorticoid receptors are less in number, glucocorticoids don't have to be given in excess. It can be given a little higher dose also, because most of the times it doesn't get attached to any of these receptors. So it doesn't make a problem. Then treat ectoparasites and secondary infections. So you take care of itching. You have to treat. If you don't treat the pruritus, the client is not going to agree for a food allergy. The problem with most of the times is, if you are not taking the client on board to treat the pruritus, the client is not going to be happy about it. So he will not have the patience to do the food trial. Then if you see that after you start the ectoparasite treatment, you do the flea control or you do the selamectin spot on, and you send the patient with for itching. You call this patient back after 1 week and you see if the client is happy about it. If he says, my cat has stopped itching, so that means it could be either flea allergy or else that, and even after stopping medicines, okay, the glucocorticoids since 4 days have not been given and the cat is not itching, that means it's flea allergy, or else it could be a seasonal allergy. But if the client says there is no response after stopping the medications, the cat is itching again, or there is no itching, no stopping of the itching, that means it could be seasonal allergy, that is FASs, or it could be non-seasonal, means it could be food allergy. So this is where you do the food trial. As I mentioned, 6 weeks minimum, 8 to 9 weeks, and ask the client to come back after 8 weeks. If there is reduction in the itching and the cat is comfortable, that means it is food allergy, and now you can start doing the food trials. But if there is partial response or no response, that means it is allergy to the environment. Same way you do for atopic dermatitis also. So you start with food trial, you confirm it. If there is no itching or no response, and if there's partial response, either it is FASs or else it is FASs with food. So you start treating for FASs with glucocorticoids and cyclosporine, but you start doing the trial also. And finally, you do the same thing, as I said, cytology, trichogram, deep skin scraping, and DTM. So this talking about, you can actually see that it was treated for fungal. There is crust, there is alopecia. This cat actually was having pemphigus, is being treated for pemphigus right now, and this cat was actually pemphigus but was being treated for fungal. But we did a cytology and we confirmed with a biopsy. This is actually a head and neck pruritus. You can see the cat is wearing a collar. This is actually a dermatophytes. It's not allergy. This cat is actually, you think this is allergy because it's generalized self-induced alopecia, but this was actually a dermatophytes. This cat, if you look at this cat, you will actually say there's nothing wrong. Absolutely nothing wrong. This cat is itching, but if you see closely, there's little bit of scaling and it's like matted hair. So we used a wood slam and you actually see that it's glowing, So this is actually a dermatophytes. Management of the allergic, as I mentioned, same thing. History is important. Recognize the pattern and finally use efficient method to do a client communication. Treatment of fleas, fipronil, selamectin spot-on, isoxazoline, we do not have yet, but we'll soon be getting in market. But allergy itching can be treated with prednisolone, methylprednisolone, and dexamethasone. Dexamethasone is actually, the US dermatologists love dexamethasone more than prednisolone also. They say dexamethasone works much better in cats compared to prednisolone. But I have never used it. I've used it only in one cat, but prednisolone is something I like more than methylprednisolone. It's written as more than up to 3 weeks, but I have seen 7 days or 8 days is enough for in case of flea allergy. Management of food allergy, as I mentioned, same thing. You just go on trials in an appropriate way. After 8 weeks, you can do the re-challenge. You can start introducing the food, but make sure that the client do not stop in between. So tell the client, you have one bag, but please don't call me on Sunday and tell, you know what, the food is over. Now what should I give? Keep an extra bag. Keep a canned food if possible, so that in case of emergencies, if a clinic is closed, you have something substitute. Management of FASs, glucocorticoids. Heads on, glucocorticoids is the drug of choice in the initial phase, and then you can go for maintenance. And maintenance is with cyclosporine. So if it is a flare-up, you have to go glucocorticoids. Injectables is not recommended, but cyclosporine you can start, but remember, it starts after 4 to 6 weeks. So if the cat is less than 6 months, you can not use cyclosporine. You have to keep on glucocorticoids. And if it is a very bad flare-up, start with glucocorticoids and then move on to cyclosporine. Oclacitinib is something I have never used, but it has been used as an off-label in 2 studies. There are 2 published studies, but they have been used only not more than 28 days. So they have used cyclosporine, oclacitinib, and then they moved on to cyclosporine. Maropitant is something that has been used in case of cats for itching, for FASs at 2.2 mg per kg once a day, and it has been used for 4 weeks. I have still not used it, so I do not know. I should be using it also, but I have not used. I'm still happy with cyclosporine and glucocorticoids. Gabapentin is something I have used, and that cat, I told you, this cat with self-induced alopecia, I actually used gabapentin. If it's a self-induced alopecia, and even if it's psychogenic, gabapentin works very well. And cannabinoids is something that is, cannabis sativa. That's also now recently. It can be used in association with anything else. Other oral antihistamines for cats is being mentioned, but again, as I mentioned, this is something you can use as a, not for a flare-up. It can be used in association with cyclosporine. Alone cannot be used in cats. So acute flare, you have to use glucocorticoids. If it's a maintenance, cyclosporine is required. Allergen-specific immunotherapy is still not something that we are using that frequently. EFAs can be used as a long-term management, not as an acute, and antihistamines, as I said. For long-term management, you can use it along with cyclosporine, along with essential fatty acids. Finally, it's allergic otitis externa, where ears are involved. About 20% of the cats can have otitis, but It can be associated with atopic and food allergy and not flea allergy. Remember, if it is otitis, you will find it's pain, so cats don't allow. Please do not clean the ears. Don't put a ear drops or ear solution so forcefully that the tympanic membrane can be damaged. So use carefully. Even if you want to put ear drops, do it carefully. You can always check for secondary infection, take a cytology and see if there is no kind of a tumor. Tumors are very common, and this is ceruminous systematosis. We have multiple cats with ceruminous systematosis. So the otitis was actually because of this. This is 3 different cats. This one, the last one, is actually a tumor where we had to perform surgery and there was bulla osteotomy we did. The next 2 are actually ceruminous systematosis at different levels. We also went for surgical approach, but here bulla osteotomy was not performed. Finally, diagnosis. Here, cytology is important when it comes to ears. Rule out otoductus and always rule out tumors. And if once you are confirmed that this is infection, please try to go with topical therapy. Do not go with oral therapy if it's for ears exclusive. Use topical glucocorticoids so that you can reduce the inflammation and make sure that it is secondary infection is taken care. Finally, take home message. Cytology should be performed at every step. Please identify the cutaneous reaction pattern. Treat the ectoparasites. Even if you don't see fleas, do a spot-on treatment, fipronil spot-on if possible, or selamectin spot-on. Do a diet trial first before ruling out and saying that this is FASs. And finally, management of flare factors and pruritus. Client communication is difficult, but please go for client communication is difficult, but make them understand, I want to treat your cat, but this is going to take time if I want to rule out food allergy or FASs. So finally, I would like to invite you guys. Thank you for listening me. I tried to not go too fast, but I had to finish this. We want to invite you from 4th to 6th June in Kolkata. This is going to be a marvelous conference of AVD, IAVD here, ICVD 5 in ITC Royal Bengal and Kolkata. And we have not just 1 or 2 speakers. This time we have 3 speakers, and they are one of the best speakers in the world. So please do attend, and as much possible, you can also come for the workshop and register as soon as possible. Thank you, guys.
Thank you, Dr. Awale, for that insightful and clinically relevant session. We truly appreciate you sharing your experience and expertise with us today. So with that, we will now move into the interactive Q&A session. So participants are requested to post their questions in the chat box for Dr. Madhavi and the IAVD team. So we'll take the questions one by one.
So there's one question that they have mentioned that they saw a case of Lynxacaris, and they mentioned ivermectin was given. So for Lynxacaris, you don't have to go for ivermectin. Please don't use for cats ivermectin. I personally would prefer going with simple fipronil. Fipronil spot-on works very well. In case of my Lynxacaris or in furmites, or even in case of lice, fipronil spot-on is one of the best choice. You can just go with regular bathing, regular shampoo bathing, and just you can use the kind of fipronil spot-on. Don't go for ivermectin. I have not used ivermectin for God knows how many years in both dogs and cats. We have newer drugs in the market. Please, you can go for that.
All right. So there is one question from Sanju Kumar. So what is the treatment for Horner syndrome in cats? It's not related, I guess, but...
No. So Horner syndrome is something that you need to first identify what is the reason for Horner syndrome. In case of Horner syndrome, one of the causes otitis media. Okay, so you need to go, if it's otitis media, first thing is you need to go for a CT scan. Horner syndrome CT scan is first you have to perform. And if it is otitis media, you need to figure it out why this otitis media is there. So there's possible that it's a kind of a you need to go with antibiotics, oral antibiotics, and sometimes ear flushing is recommended with otoscope, and otoendoscope is required here. So that is actually the drug, that is how you actually manage Horner syndrome also, or otitis media. But as I said, I do not have that, so I would either refer this dog for otoendoscope, but before that I will go for CT scan. I have one dog with Horner syndrome, but never seen in cats. I'm not sure it's seen in cats. I've never heard about it, so not
Right.
possible.
So we'll take next question from Ankit. Can prednisolone be used along with oral antifungal in cases of dermatophytophytes in cats, and what is the duration of treatment?
So, see, ideally, dermatophytes, if you have confirmed, okay, if you have confirmed that it is dermatophytes, your treatment more than, see, you can give if it's very bad itching, okay, but I do not give more than 2 to 3 days. That is just so that the client is little calmed down. But ideally, glucocorticoids is not recommended for dermatophytes treatment, right? So I do give prednisolone for just 2 to 3 days, just so that the cat, but I like to keep on e-collars. That is my first choice. I like to wear t-shirts for the cat, so that it is, I go with regular bathing. So instead of once a week bathing, I will go for twice a week bathing. That actually eases out much better. And I tell the client, just you have to bear till our treatment starts. For itraconazole, you start, obviously, more, itraconazole is the drug of choice. We don't give ketoconazole in cats, right? Since we are talking about cats, itraconazole is given. So you go with itraconazole, and we do give yeah, pulse therapy. Pulse therapy is 7-7, but I like to give 10. First a time I give for 10 days, and then I go for 7 days. So that is how I go. But 2 to 3 days is maximum. Try avoiding as much as possible for at least dermatophytes.
All right. So next question we'll take. So for mange infection in cats, is ivermectin can be used, or there are more chances of high chances of ivermectin toxicity?
I've not used ivermectin, guys. Go for salamectin. Salamectin works very well. And now when we have flurananol soon coming, we should not be worried about it. But why ivermectin? Why do you want to go with ivermectin? Salamectin works magic. You don't have, for this ear mites, salamectin. For scabies, salamectin. It's Linksacaris, fipronil is works better. In case of lice, fipronil works better.
All right. So next question is how to approach for stud tail in Persian cats.
See, stud tail is something that I first prefer perform a cytology. Okay, it is a little difficult to manage, so I generally go for cytology and see that there is no secondary infection. If there is secondary infection, I go with only topical therapy. Ideally, if it's a stud tail, performing surgery is the best option. You neuter it, it's not a problem. But if you want to go with stud tail, you just go with a simple antibacterial and manage it. Just tell the cat owners to manage. Whenever there is secondary infection, treat it. Otherwise, you don't do anything. Only in one cat, I had used a hydrocortisone spray just for 7-8 days, just because the cat was irritated with it. But just for 7 days, I had used.
All right. So are the signs of vomiting and diarrhea common in dogs also in cases of food allergies?
Vomiting, not, but diarrhea, yes. Not diarrhea, I would say, but it's more of a semi-solid stool, little gassy, flatulence, and everything. But it's seen, it's definitely seen. Vomiting, I have not seen in dogs. Cats, I have seen. Cats are more sensitive, they are very fragile. So, yes.
So next question, fipronil and selamectin, which one is better, ma'am, for otodactyl cyanosis?
Yeah,
Why
I
we are
just,
not using ivermectin? Are there any side effects associated? And ear mites is very common in cats.
as I said, I just mentioned it. it's selamectin. When you have better drugs, why do you want to go for ivermectin? It's old drug. We need to move on to the new products. Our companies, these companies are coming with new products. The companies are coming with so many new molecules. So why do you want to go with the same old molecules which is there? They are using all these companies are using a lot of R&D. They are using a lot of efforts to get new molecules in our country. So let's use new molecules, and it's more safer, right? So why not go for that?
Yeah, so Srijan is asking, can you explain indolent ulcer once again?
Yeah, I'll just, because it's time limit, we'll just quickly explain.
Quickly. Yeah.
Indolent ulcer means basically it's a small, small ulcer on the lip. It's a kind of a reaction pattern of EGC. So in EGC, indolent ulcer is the first one. It may have pruritus, may be itching, may not be itching. Mostly it is not itching unless and until there's secondary bacterial infection. It starts with a small ulcer on the lip. The owner thinks the cat must have got hurt. Then that ulcer starts moving ahead and it starts bigger and bigger and bigger. And then you find that kind of a lesion where it is extensive. You see there's fibrosis, it becomes thick, fibrosis means it's thick, and finally it starts moving up towards the nose, and there the nose nasal planum gets affected. And you think this is an SCC. So this is not an SCC. If you find something on one side particularly more, then it is possible first do a cytology, confirm that there are actually eosinophils. And if you see indolent ulcer, if you look at the oral cavity, you will see that there is possible on the tongue also. That means this is a EGC pattern. And now you know this is a EGC pattern. You are going to start looking at allergies. But rule out there is secondary infection, rule out there is no fleas, rule out there is no dermatophytes, everything is clear, and then start looking towards food allergy, rule out food allergy with a food trial, and then finally go with FASS.
All right. So Mukul is asking, this fipronil spot-on is not available in the government hospitals in Rajasthan. So can you please suggest any alternative appropriate drug for that?
Oh, tell the companies to get their products to you. Tell the
All right.
companies. Tell them, no alternatives. It's a very basic drug. Tell all the companies to get it for you.
Yeah, all right. So we'll take the next question now. So I guess this is already addressed by doctor. The food elimination trial in cases of food allergies after 8 weeks of hydrolyzed protein diet. What if allergy gets relapsed after giving a normal food?
Yes, it does get. It does get. That's why I said you have to do re-challenge. It does get. I have this cat, which I showed you the photograph. We started with a food, beautiful. She did very well. Her name is Inu. We started with a food trial very well. After 8 weeks, we started doing the food trial. We started with a particular brand food. They wanted to start with a particular brand, and the cat started itching. The moment the cat started itching, I go back to the food trial. Okay, I go back to the hypoallergenic or analogenic diet and I reduce that itching and I tell, okay, this food is cross. It's no more to be given. Then I move on to the next brand. Then I start with the next food or with the next protein. Okay, I do these trials. If I have this dog, it's a puppy. 6 weeks, 6 months puppy. We started with a food trial. We did very well with hypoallergenic food. Amazingly food this. We started with chicken. This dog within a day started scratching. Now we know this dog is allergic to chicken. So in life, chicken is not to be given. We started with fish. We started with fish, and then this dog is doing very well. So now we know this dog is not allergic to chicken. Is allergic to chicken, but not to fish. Now we are doing food trials because they cannot cook fish every day. So now we are looking for a commercial food which has fish in it so that they can start giving and this. Then we started with, along with fish, we started some vegetables. We started with some veggies. We started with a treat. You do trials, and that is called as re-challenge. You challenge the dog.
All right. So next question, what is the choice of antibiotics in cats in cases of dermatitis of bacterial origin? Whether to go for amoxicillin, cefalexin or cefavixin?
Oh my God. Guys, first go with a lower drug. It's not about cats, dogs or cat. Always go with a lower antibiotics. For dermatology, please do not use higher antibiotic. If you want to use a higher antibiotic, always go do a AST. I'm telling it particularly for dermatology, don't go with higher antibiotics. Start with clindamycin, cephalexin or amoxicillin. In cats, I like clindamycin more because it's once a day. Cat owners are the cats don't take medicines, they are irritated. So giving twice a day, it's a task. So I like once a day. So I start with clindamycin first or amoxicillin if it's an old cat. And I always go with some kind of a, this, sorry. I always go with, a lower antibiotic. If the cat is not responding, then I go with a AST first, and then only I go with the higher antibiotics.
All right, doctor. So, next question we'll take from Dr. Prerna. How can we diagnose the fungal disease in cases we are not able to do the fungal culture? Is there any easier and quicker way?
So you do a woods lamp. I don't do that much of fungal culture. I do woods lamp and cytology. It's a very easy way. Woods lamp is something that is cheap. You don't have to invest. You check most of the times microsporum glows. And if it's woods lamp is negative, I always, even if it's positive or negative, I do a cytology. You see the beautiful arthrospores, that nice budding yeast with a nice capsule around it. And you do this, and you don't have to go for fungal culture. If this is there, I don't go for fungal culture. I go for fungal culture if and only if my cat, though I'm not able to see, but I'm suspecting something, and only then I go for fungal culture.
All right. So we will take one last question since we are short of time. So there is one case of 1-year-old cat. It has itching, hair loss, and scabies on the neck and tail region for the last 10 days. She's an outdoor cat. What could be the diagnosis and treatment?
So
This
as
is
I
from
mentioned now, you are going to tell me this, you are going to tell me. You see the cat, first you're going to go with the reaction pattern, right? You're going to see the cat, you're going to take a nice history, looking at the presentation. I hope I'll get an answer tomorrow and you'll tell me, what, this is how we approached. You see the cat, you ask a good history. You have asked the history, it's outdoor cat. You look at the reaction pattern. You look at the reaction pattern, you are going to first see and you're going to check whether it is fleas. Do the spot on treatment first and send this cat with anti-itching medicines. But before that, before giving glucocorticoids for the itching, you make sure that cat does not have any scabies. No, do the cytology. See there is no bacterial infection. See that there is no fungal infection. Send this cat back and call this cat back after 10 days. If the owner says now there is no itching, that means it is flea allergy. If the cat comes back to you saying that the cat was okay till the glucocorticoids were given and after that the cat started itching, then you go for food allergy or finally you go for FASS. But rule out dermatophytes, rule out with cytology, bacterial, malassezia, and do a skin scraping.
all right, doctor. So Akhila is asking dose of clindamycin that is used in cats.
Cats are the same, the dogs. It's 11 mg per kg, but it's severe infection, I go BD, it's 22 mg. And if it's a very mild, I go with 11 mg. Ideally, it is 22 mg for dermatology. But
All
in
right.
case, I go with 11 mg also.
Okay. So last question we are going to take, and then we will wrap this Q&A session. Can hypoallergenic and allergenic diets be used for lifetime if necessary?
Yes, actually, I have one cat who is on. I've tried every possible food for her. She's allergic to everything. That cat is an amazing case. We started with hypoallergenic diet. The cat, if we give hypoallergenic diet, she's doing very well. Her itching is very well, but she gets slight semi-solid stool. So we tried all different brands. Whatever is available in the market, this client is a sweet client. They tried every single brand in the market, but this cat is allergic to. She starts scratching on the head and neck. So we kept her on gastro diet for a few days. The gastro diet, if you give gastro diet, her loosies stop. Her motions are perfect, but she starts itching. So now I've kept this cat almost more than 7 years, I think. Yeah, 7 years I've kept her. She is on hypoallergenic diet 70% and 30% of gastro diet. So I have used so much of efforts to keep that diet for her. The cat owner is very sweet. I had one sample from US once for analogenic for cat. When I gave that to food to cat, this cat's itching stopped and the stool was okay. But they are not able to get that food from US anywhere. They don't have anyone. So unfortunately, this is how they are managing. 70%, 75% they keep on hypoallergenic food and 30% on gastro food. So yes, you can keep, but I don't keep most of the times.
All right.
So
Thank you,
so
doctor.
the match started, New Zealand versus India.
Yeah.
Thank you so much. Thank you for listening. I think my husband is also continuously looking at the television, so I have to also go.
Yeah. All right. Thank you so much, Doctor,
Thank
for
you so
patiently
much.
answering all the questions. So to conclude today's webinar, I invite Dr. Nilesh Sindhu to deliver the vote of thanks. Over to Dr. Nilesh.
Yes, ma'am.
Yeah, over to Doctor.
A very good evening to all of you.
Good evening.
Well done, Dr. Madhavi.
Thank you.
This was very wonderful presentation, and I'm thankful to Drools also for organizing such a wonderful and fantabulous lecture in collaboration with IAVD. And you were not fast, but sometimes people may aspire it fast, but you were okay in your speed, although your husband was forced to say. Otherwise it was okay, and all the queries were well attended by yourself.
Thank you.
And I'm also thankful to our president sir, vice president sir, IAVD, for organizing a very good lecture on this dermatology. And we all invite you for IECVD 5 at Kolkata. Then we will get such wonderful lectures there also. So all the attendees are requested to attend our conference also. And thank you, Dr. Madhavi. Thank you, Team Drools. They all are wonderful. They are all are best among all the teams. Thank you again.
Thank you.
Have a nice time. Thank you. Bye bye.
Thank you so much.
Thank you, Dr. Nilesh. Thank you, Dr. Madhavi, for such a wonderful session. And thank you, entire team of IAVD. And thank you to all the participants for joining us today. We look forward to your continued participation in our upcoming sessions as well. So with this, we conclude today's session. Thank you, one and all.
Thank you so much.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Fit clean.